Well, I was diagnosed with a secreting neuroendocrine tumor called an extra-adrenal pheochromocytoma in 2015, after having been ill for over a decade and been misdiagnosed with several other disorders and illnesses from some of the top institutes and medical centers in the country. Average day for me when my tumor was active was I would sweat profusely, have elevated blood pressure, have fits of rage, body tremors, nausea, weight loss, incredible fatigue, followed by incredible bursts of strength. My friends used to call me the Incredible Hulk. And I went for many, many years being very ill and having periods of time when I was hospitalized several times a year. And there was a period of time when I would go to the emergency room 2 or 3 times a week with episodes that involved extremely elevated blood pressure. None of the doctors that I saw, and I went to many different organizations, university medical centers, tertiary care centers, including the Mayo Clinic, none of them were able to diagnose me properly. And finally, out of desperation, I started researching myself. And I came across a differential diagnosis for what I suspected was this type of tumor. My endocrinologist was testing me for 5 years doing the biochemical testing to look for something called catecholamines in the blood. And there's something called a diagnostic protocol where you have to meet a minimum threshold in order to be diagnosed with having one of these tumors. And my elevations of catecholamines never met that minimum threshold. So the doctors kept telling me it was impossible for me to have this tumor. Well, after 5 years of testing, and I found this differential diagnosis of another disease called mast cell activation disease. And what that disease involves is a process where the body's mast cells degranulate inappropriately, and they release over 200 known cytokines and bioagents into the body, many of which are designed to help the body in times of crisis, but they can be very harmful to the body. Some of those substances are prostaglandins and histamines and leukotrienes. And I found out that there's a large community of people, of patients, that have this disease, but they're not getting diagnosed with it either because it's so very little is known about it. And there isn't much research about it at all. There's only a handful of doctors in the country that know what the disease entails and how to diagnose it properly. So I went to one of those doctors and I said, well, my endocrinologists tell me I don't have this kind of tumor, so it must be mast cell disease. Could you please help me? And he said he would. He gave me some testing. And he went ahead and also suggested that I have some full body diagnostic imaging, which up until that point, the endocrinologist had not ordered for me. The reason is the diagnostic protocol for the pheochromocytoma says that if you don't have the elevations of 3 to 4-fold for the catecholamines in the blood, that diagnostic imaging is not suggested, it's not required. And thankfully, because of this doctor's suggestion, who's not an endocrinologist, he was a hematologist, I was able to get a full body scan. Concurrent to that, he ran the necessary blood testing for the mast cell disease. I received a phone call the day of my scan, and I was told to come back to my doctor's office, and that they had found a lesion in my abdomen in the retroperitoneal area that was suggestive of something called a paraganglioma, which is another word for extra-adrenal pheochromocytoma. So after some investigating, it was determined that that is indeed what it was. I went to the Cleveland Clinic in December of 2015 and had a world-class procedure by some excellent physicians and surgeons, and I had the tumor removed. Immediately after removal, a lot of my symptoms, 85% of my symptoms went away. And it was a great sense of relief and a realization that I had been very ill for a lot longer than even I realized. So it was life-saving surgery, and I'm so grateful for that. But one thing I did find out was that doctor, the first doctor I went to for the differential diagnosis, he called me back and he said, you know, you have elevations of certain biomarkers, mediators in your blood that are indicative of mast cell disease. And so over the course of the next year, I had more testing, and I eventually found myself in Minnesota at the office of Dr. Lawrence Afrin, who's considered one of the world's premier experts in mast cell activation disease. And he diagnosed me with that disease as well. So while I'm not dying anymore, my days aren't what I would consider normal. I still have life-threatening anaphylaxis events as a result of the mast cell disease. Fatigue, food intolerances, medicine intolerances, and it makes life difficult, but every day is a gift. And I've come so far and met so many people in this community that are far worse off than I, and it gives me courage and hope that cures and treatments are going to be found for these rare diseases. And I thank you for the opportunity for letting me tell my story.